Carrying angle, the carrying of the elbow, the angle between the long axis of the humerus and the ulna when the arm is in the underankle positions. This is called because it allows the forearm to angle away from the body and the load is carried on the hand. Carrying angle is generally carried in the female than males. Then swelling, olecranon bursaris, there's a goose egg or the olecranon process, the inflammation of bursa. Then normal functional position, 90-degree flexion of the forearm midway between pronation and supination, writing in the slight pronation, eating forward flexion of the shoulder along with slightly more elbow flexion of up to 120 degree. What is a triangle sign? The fracture, dislocation and degeneration, the triangle no longer exists. And 3 bony point relationship. Compare with the opposite normal elbow, middle epicondyle, lateral epicondyle, olecranon. Flexion, the both are the triangle shape. In extension position, both on the same line. Then attitude of the limb deformity, cubitus varus deformity. That is a construct deformity, most commonly occurs in the supracondylar fractures. Then cubitus valgus deformity. Then examination, active movements, loss of the elbow extension, the intra-articular pathology. Then active supination, ensure that the shoulder is not abducted to compensate for increased supination. Then active pronation, not abduction. The patient complains of the pain in doing combined repetitive movement and sustained position. These specific movements include the assessment. Patient with difficulty or cannot complete the movement. Pain-free, that is no severe injury to muscles. Then passive movements. Active range of motion full, over pressure to test to the infield. Active range of motion to full, not full. Passive range of motion done at the test and the infield. And capsular patterns. Special test for elbow joint, test for ligament instability. That is the first test is the valgus test. Patient positioning is the sit with the test elbow with the flex to 22-30 degree. Therapist position is the stand with the distal around the subject, middle wrist and proximal hand around the lateral elbow. Procedure, abduction or valgus force at the distal forearm. Positive sign, pain over the middle epicondyle of the palpate indicate the middle collateral injury. Then varus test, patient position sit with the test elbow at the 22-30 degree. Therapist position, standing beside the patient, examines hand, middle distal humerus, other hand placed over the radius. The procedure of adduction or varus force applied to the distal forearm. Positive sign, pain over the lateral epicondyle while the palpate and palpate indicates lateral collateral ligament, that is a varus instability. Test for biceps rupture, hook test. The patient positioning sit and stand with the shoulder abduct 90 degree and the arm supinate. Therapist position, support the patient arm with the ask the patient actively supinate the forearm against resistance. The positive sign, hook the underneath biceps tendon indicate biceps tendon rupture. That is a hook-like procedure. Test for epicondylitis, lateral epicondylitis, that is a Coulson test. Sit and stand and ask the patient to actually fist pronate the forearm and ideally deviate and extend the wrist. Stabilizing the involved elbow and while palpating lateral epicondyle to pain shorted. The pain over the lateral epicondyle indicates in this elbow. Middle epicondyle, that is the goal for elbow. Patient pushing the sit and make the flat fist and involved. Palpate, therapist position, palpate the middle epicondyle and will grasping the wrist and passive supination and extension of the elbow and wrist. That is a pain over the middle epicondyle of the pain indicates a Goldfuss elbow. Test for neurological dysfunction, elbow flexion test. Patient is asked to fully flex the elbow with the extension of the wrist. Hold the position of 3 to 5 minutes. Positive sign, radiating pain indicates the cubital tunnel syndrome, that is ulnar injury. Pinch grip test, which is the patient is asked to pinch the tip of the index finger and thumb together. Unable to touch the tip to insert the abdominal pulp to pulp pinch, indicate the entrapment. Anti-interstice nerve, that is between the pronate teres muscles. Then assessment part, same name, age and sex, occupation and address, date of admission, date of assessment, date of review. It's a subject assessment, chief complaints, present medical history, past medical history, surgical history and family history, and then pain assessment, side, onset, duration, type of pain and nature of pain, aggravating factor, relieving factor, and assessment scale, a numerical pain rating scale, visual analog scale. Vital signs, temperature, heart rate, respiratory rate, BP, saturation. Observation is a posture, carrying angle, swelling, redness, bruising, bone in soft tissue contact, deformity is the construct deformity, normal functional position, writing and eating, triangle sign. Palpation, warmth, tenderness, pulse, swelling, examination, muscle tone, range of motion, active range of motion, passive range of motion, resisted isometric movement, muscle power. Reference mainly assessed for